This is the Pelvis and Perineum tutorial presented by the SHRTB with reference to Recent Laws of Anatomy by Richard Gregg, Waynes Vaughan, Adams Mitchell, Richard Tibbett, Paul Richardson, and Ansel Holm. Okay, in this tutorial, we're going to see the pelvis and perineum, the constitution of the pelvis and perineum. So, we initially seen the abdominal wall, and we said that at the inferior aspect of we initially seen the pelvic wall, and inferior aspect of the pelvic wall, we said that they were the ramification of the obturator fascia forms the tendinous arc, and this is where the levator and the muscle is going to lie. So laterally we had the obturator muscles, which are located here, and we have inferiorly the levator ani. The levator ani consists of three muscles. The first muscle will be this one here, which is the pubococcygeus muscle, connected anteriorly with the pubic crest and posteriorly to the coccyx and the anococcygeal ligament. The second muscle seen above here will be the iliococcygeus muscle. Iliococcygeus muscle connect the anococcygeal ligament to the tendinous arc and the part of the ilium. So now we said and these are the two main parts. So from the superior view, we can see these two parts of the levator ani muscle. But inferiorly, we are going to see another part of the levator ani muscle, which is going to be the puborectalis muscle. So these are the three main parts of the levator ani muscle. The iliococcygeus muscle is one muscle on its own. It is not a muscle or involved in the formation of levator ani. We have the piriformis again here, forming the lateral wall of the pelvic the pelvic cavity. So this is what we can see here. You see that the levator ani muscles are going to do their ramifications while leaving some two openings. You have the first opening here, which is urogenital hiatus, and the second opening here, you have the anal aperture. Here you are going to have the obturator canal. Here you are going to have the sacrospinous ligament, and covering the sacrospinous ligament, you are going to have the iliococcygeus muscle. And here you're going to have the sacral tuberous ligament. And we said initially that the piriformis was passing into the greater sciatic foramen, and as it passes in the greater sciatic foramen, it's a very important landmark which divides the foramen into two parts, the superior and an inferior part. The superior part will be involved with the for the naming of the blood vessels and add blood vessels superiorly. Example, the superior gluteal artery and superior gluteal vein. Both of them are passing superiorly to the piriformis, while the inferior gluteal artery and inferior gluteal vein are passing inferiorly to the piriformis, and all of them are still passing in the greater sciatic foramen. So now let's visualize now the pelvic wall from below. Now when visualizing pelvic wall from below, we can find now this next muscle here, and this next muscle is part of levator ani, and that's called the puborectalis muscle. So the puborectalis muscle starts from the pubis anteriorly, goes inferiorly and posteriorly as such, and is going to be enclosing the anal aperture. So you have the anal aperture at this portion here, it goes surrounding. So this is a puborectalis muscle. Here is a pubococcygeus muscle, and there are different parts of the pubococcygeus muscle. You can also have a pubourethralis. So all of these are coming from the pubococcygeus muscle. And we have the iliococcygeus muscle. So these are three muscles involved with the levator ani. Here you are going to have the ischial tuberosity, the urogenital hiatus, the pubic symphysis, the tendon of obturator internus. You have the sacral tuberous ligament here, you have the coccyx here, the iliococcygeus, you have the piriformis here, and we said the piriformis is going to pass through the greater sciatic foramen, while the obturator incline is going to pass through the lesser sciatic foramen, and then this is going to descend through the lesser trochanter, and this is going to end at the greater trochanter at the position of the intertrochanteric trace, and this is going to end at the position of greater trochanter at the superior part. So now let's place the visceral structures of the male content inside the pelvic cavity. So when placing the visceral structures of male content inside the pelvic cavity, you're going to have this one here is going to be the visceral fascia. So we have the vesical fascia, which lie above the bladder or the vesi. Here is going to be the trigone, and you'll see the clinical relevance of trigone when you study the urogenital embryology. You have the ureteric orifice. So the urogenital embryology has been performed already in a tutorial, so go and see the urogenital embryology to see the implication of trigones with respect to urogenital system. Here you are going to have the ureteric orifice. Here you are going to have the detrusor muscle. The detrusor muscles are the muscles for the contraction of the bladder. You need to know that the contraction of the bladder is occurring due to the sympathetic nerves. While the parasympathetic nerve, the bladder muscle contract in order for you to urinate with sympathetic nerve, while the parasympathetic nerve are going to contract inside the external urethral sphincter. So what relaxes the external urethral sphincter are the sympathetic. So for you to urinate, you need to have a sympathetic stimulation, and for you not to urinate, you need to have a parasympathetic stimulation. So you have a pubic symphysis here. Here is going to be the internal urethral sphincter. Here you are going to have the prostate. Here you have the deep perineal pouch. I am going to visualize the perineal pouch in the latter section of this tutorial. And superficially to the deep perineal pouch, we are going to have the perineal membrane. Deeply to the deep perineal pouch, we are going to have the levator hernia. So now these are different parts, and this is the deep transverse perineal muscle. The deep transverse perineal muscle is going to be lying inside the deep perineal pouch. We have the deep part of the external anal sphincter. We have the superficial part. We have the deep part of external anal sphincter. The superficial part of external anal sphincter. We have the cutaneous part of the external anal sphincter. So you have the deep, superficial, and cutaneous part. All these are for the anal sphincter. I have the rectum here. So now, having a section through the body from in this direction here, a coronal section at level of posterior aspect of the males is going to be shown as such here. So having a coronal section, you're going to have this. We see that you have the common iliac artery here, you have the common iliac veins here, all lying at the level of the iliac fossa. So now we have the erectile fascia here. Here you are going to have the characteristic of the rectum is that it has a middle transverse fold, it has the inferior transverse fold, and here you have the anal canal. The anal canal characteristic is that it has anal sinuses, which are these grooves here, and also have anal columns, which are the ridges here. We also have the anal crypts located laterally here. So we have anal crypts, anal sinuses, and anal columns. So all of these are characteristics of the anal canal, while the characteristics of the rectum is that it contains the middle transverse fold, the superior transverse fold, and the inferior transverse fold of the rectum. All these are characteristics of rectum. So the longitudinal muscle of rectum, and we have the sacral muscle of rectum. So you need to know that inside the colon, the longitudinal muscles are characterized as being teni coli, but all of them are going to ramify to form a continuous strip of muscle called longitudinal muscles of the rectum. So now, when visualizing below, this is deeply and this is much more superficially. So when you visualize much more deeply, you see the tendinous arc with the levator ani muscle, iliococcygeal part here. So this is the iliococcygeal part of the levator ani muscle, and you see that the levator ani muscle is the one which provides the with the pubis rectalis. So with the pubis rectalis is here, and the muscle which is used for you not to have you see that there are certain times you can want to defecate, and you at a certain period of time you want to stop. You don't no more feel the sensation of defecation. This is because of the pubis rectalis muscle. At times when the pressure of the defecation descends at the level of the anal canal, the pubis rectalis contract, which is going to cause the this anal the pressure to reduce. So it's going to cause the fecal material not to pass through the anal column, so through the anal canal. So this is due to the action of the pubis rectalis muscle. So now you see that the inferior, the levator ani muscle is also the muscle which is involved now with the production of the external anal sphincter here, because it's an external anal sphincter as such here. Here you can have the external renal venous plexuses. These are the external renal venous plexuses at this position here. This is the internal anal sphincter, which is formed from the longitudinal muscle, which formed from the circular muscles of the rectum, while the external anal sphincter are controllable, coming from the levator ani muscle. Here is going to be the obturator internus, and here is going to start from the tendinous are going to come from the obturator fascia. Ramification of obturator fascia are going to form the tendinous arc here. So now we come here on this other side. This is superficial view. So on the superficial view, we are going to have here the iliococcygeus, here the obturator internus. Here you are going to have the pudendal canal. The pudendal canal lie inside the obturator fascia. So we have the pudendal canal. Here you are going to have this fat. At this portion here, you have the issue anal fossa, and here is going to be the fat inside the issue anal fossa. And this is a potential space in order for you to have the rectum to be capable of expanding. So now these are all the different structures when you had the coronal section of the rectum with the mucosa of the rectum here. So now the ductus deferens and the ureter, you need to know that the ductus deferens passes directly as such here below the ureter as such. It comes from below and then it turns. So this is how the ductus deferens is going to pass. So this shows a male structure. So now, still coming with males, we have the study of the urinary bladder. Upon the study of the urinary bladder, you see here the right ureter. You see the study of we have the right ureter here, the left ureter here, and you have the bladder here. So here at this position will be the urachus. Here is going to be an obturator foramen. Below the level of the bladder, you have the prostate gland. So at this portion here is a deep perineal pouch. This is your perineal membrane. Anteriorly here, you are going to have your puboprostatic ligament. So now let's come back to visualize again the bladder much more. So the bladder, you have to know that we have the vesical fascia, which is at the superficial part of the bladder. Then you have the detrusor muscle. Then you have the mucosa of the bladder. At this position here is the urachus, which is the letter derivative, the derivative of the arachnoid, the divinity of arachnoid in the fetus. As you can see in the embryologic origin inside the embryologic tutorials of urogenital system. So we have the prostatic urethra here. This is the prostatic urethra at this position here. We have the capsule of the prostate. We have the prostate here. Here is the bladder neck. So this is the trigone of the bladder, this is the apex of the bladder, and this is the body. So these are the different structures. Upon the morphology of the bladder, we have the apex, we have the trigone here, we have the body, and we have the neck. So these are all the structures of the bladder. So now the bladder neck is located here. At this position here, you have the fibromuscular stroma, and the fibromuscular stroma is the one which is involved with the benign prostatic hyperplasia, because it is going to absorb excessive calcium ion and is going to become larger in size and increase in number of cellular division. So here you are going to have the external urethral sphincter, which is going to prevent urine from coming down here when these muscles are contracting. So now let's visualize now the bladder in females. In females, you see that there is no more prostate gland, and there is also going to be a vaginal opening, which is going to open through the perineal membrane. So now we have the right urethra here, we have the bladder here, we have the left urethra here. So anteriorly, inferiorly at this position here, you know that in the upper diagram you had a prostate gland, so you had a puboprostatic ligament, but in female you don't have a prostate gland, so it's a pubovesical ligament. At this position you're going to have the urethra, here you're going to have the bladder, the right and left urethra here. So now let's continue with visualizing the trigone posteriorly. So the trigone posteriorly can be characterized as having a fold here, which is the interuterine fold between the two ureteric orifices. Interureteric fold. This is the interureteric fold between the two ureteric orifices, which are going to be insertions of the right urethra and the left urethra. So this is your trigone, which is going to be found here. Inferiorly, you're going to have the external urethral sphincter, and here you're also going to have the compressor urethral muscles. You need to know that unlike in males we only have the external urethral sphincter, which is going to be a sphincter at the level of the external part of the bladder. But in females, since this is because the males have a very long urethra and it is difficult for urine to directly flow out of the bladder, so to directly flow out of bladder. So you see that since the male urethra is very long, it shows that only one muscle can be capable of regulating the flow of urine from the bladder to the outside part of the penis. But in the female, the urethra is only 3 to 5 centimeters. This is why there is an additional muscle which is going to control the flow of urine outside to the external part of the body, and that is the compressor urethral muscle. The compressor urethral muscle was not found in males, but in females it's added. So we have the compressor urethral muscles, and we also have another muscle. So there are 3 muscles involved with the sphinctering of urine from the bladder. We have the external urethral sphincter, we have the compressor urethral muscle, and we have the sphincter urethral vaginalis. These are 3 muscles which are involved here. So now you have the inferior vena cava here. Here you are going to have the right internal iliac vein. Here you are going to have the right internal iliac artery. So now this is the internal iliac artery, the main artery which are involved with supplying the pelvis. So now the internal iliac artery are going to have these different derivatives here. Here is going to be the part of the ductus deferens which is coming. As the ductus deferens which comes here is going to have an ampulla of the ductus deferens, and it's going to bind with the seminal vesicle here, and as it binds the seminal vesicle, it's going to form the ejaculatory duct, which are going to bind posteriorly to the prostate gland. So now you see here the cause of the ductus deferens in the abdominal cavity. So it causes above here in the spermatic cord. As it comes in the spermatic cord, passes through the inguinal canal. So comes above here, is going to pass posteriorly to the inferior epigastric artery, passes anteriorly to the right external iliac and this other artery, the right internal iliac vessels. As it passes anteriorly here, it's going to pass again anteriorly to this other muscles, pass anterior to the pectineal line here, then passes anterior to this line, this muscle which is the obturator internus, and these vessels here. These vessels here are the other vessels, the obturator arteries. So these are the obturator arteries which comes here. So they pass anteriorly here and then come and pass posteriorly to the ureter. So So this is the course of the ductus deferens. Pass posteriorly to the ureter, then goes and form the ampulla of the ductus deferens. With the ampulla and ductus deferens going to bind with the duct from the seminal vesicle, all of them are going to form the ejaculatory duct, which is going to enter into the prostate gland. So now this is what we have visualized here. Now coming inferiorly here, we have said that this part here was the corpus cavernosum, and this internal part here was the corpus spongiosum. So now the corpus spongiosum is going to contain the spongy urethra. So you are going to have the spongy urethra inside. This is a prostate gland. Here inside here, you are going to have the deep perineal pouch, and inside the deep perineal pouch you find that there is number 1 muscle here, the external urethral sphincter, and number 2 muscle here, the deep transverse perineal muscle. We also have a superficial transverse perineal muscle, which is lying now in the, because this is a deep perineal pouch, this is going the superficial transverse perineal muscle is going to lie in the superficial perineal pouch. And lastly, we also have inside the deep perineal pouch the bulbourethral gland. Now, seeing the fascia which is going to cover externally the scrotum is going to be called the dartos fascia. So this is the navicular fossa here. This is the glands of the penis, and glands of this at the level of the navicular fossa, glands of the penis is going to produce some secretory fibers for the pre-lubrication of the spongy urethra during an excitation and sexual intercourse. So now here you are going to have the different things which are involved in the wall of the scrotum. The wall of scrotum, you are going to visualize it much more down, but here you can also already visualize the cremasteric muscle. We can visualize the Tunica Albuginea, the parietal and visceral layer. We can visualize the musculofascial pouch and all that with the head of the epithemis here. This is a pamphiniform plexus. So now, having a coronal section through the vesicle, the vessie or the bladder, and the prostate, you are going to see this. Here is your trigone. Here is your prostatic urethra. So the prostatic urethra is going to enter as such. At this portion here, you have the glandular element of the prostate. Here you are going to have the prostatic venous plexus. Here you are going to have the opening of the prostatic duct. The prostatic duct does not open at one portion, but opens all through the urethra. So opening of prostatic duct are all through here, because these are the glandular element of the prostate prostate. You have the prostatic utricle. The prostatic utricle is going to have this portion, and you're going to have the 2 opening of the ejaculatory duct. This is the 2 opening of the ejaculatory duct here. This is the prostatic utricle. At the prostatic utricle, you also have the opening of the ejaculatory duct. This is going to be a deep perineal pouch, your external urethral sphincter. So yes, at this position of the deep perineal pouch, you instead have now a membranous urethra. So now at this portion here, you have the superficial perineal pouch. This is superficial perineal pouch. We see that the deep perineal pouch, upper part of the perineal pouch here is going to be the levator hernia muscle with a small perineal membrane here. Here we have this is a deep perineal membrane, and this is superficial perineal membrane. So all of that is going to cover the deep perineal pouch. Now superficially to the superficial perineal pouch, you're going to have the superficial fascia, and deep to it you're going to have the perineal membrane, and you see here the corpus of the penis. So you have the corpus spongiosum here, and here you're going to have the penile urethra. So now let's visualize the structure of the prostate gland. So at this upper portion here, you're going to have the seminal vesicles. Seminal vesicles and the ampulla are going to bind to form the ejaculatory duct. Ejaculatory duct are going to enter the central zone of the prostate. So as they enter the central zone of the prostate, they're going to come out at the level of the utricle of the seminal colliculus. You have the seminal colliculus here at the utricle of the prostate. So they are going to enter and bind here with the urethra, comes out through the membranous urethra, and then come out through the penile urethra. At this portion, this region here is going to be the anterior region, the non-glandular region of the prostate. Here is going to be the transitional zone. The transitional zone is a zone in which the urethral passes, while the central zone is a zone in which the ejaculatory duct passes. And posterior here you have the peripheral zone. The anterior zone is a non-glandular zone. The central zone is the zone which contains the ejaculatory duct. The transitional zone is the zone which contains the urethra, while the peripheral zone is a zone which is much more involved with glandular activity of the prostate gland. So now let's visualize now again the posterior aspect of the bladder and the prostate gland. You see here that there's a left ureter. You see the ductus efferent passes posterior to the left ureter. Here is going to be the trigone. The trigone is going to be formed due to the opening of the ureter here with the interureteric fold, and the opening and the binding of this portion here of the vas deferens and the seminal vesicles at this portion. So this part here is going to form what is called the trigone. So this is a ureteric bladder. So the right ureter, the ductus deferens at this portion here, this is the seminal vesicle. So this is the ampulla of the ductus deferens. They are going to enter the central zone of the prostate, then they are going to bind with the urethral level transitional zone. So now this is how the inguinal canal is formed. So this is our inguinal canal at this level. Inguinal canal open at the superficial inguinal ring. The deep inguinal ring is going to have an opening inside the abdominal. Is having an opening inside the abdominal cavity, while the superficial inguinal ring is going to have an opening outside the abdominal cavity, and they are going to pass directly in front of the pubic bone. So this is a superficial inguinal ring. With the superficial inguinal ring has first a fascia which covers it. So there is the spermatic cord has fascia which covers it. The fascia above here is going to be called the first fascia above it, which is going to be called external spermatic fascia, and this fascia comes from the external oblique muscle. So now let's visualize now the scrotum when it's cut from external to internal. It starts with the skin of the scrotum. After the skin of the scrotum, we have the diatus fascia. Diatus fascia, which is formed still at the level of the external part of the body. So now after the diatus fascia, we have the external spermatic fascia. The external spermatic fascia is going to be formed from the ramification of fibers from the external oblique muscle. After the diatus fascia, external spermatic fascia, we have the cremasteric muscle. The cremasteric muscle is going to be formed from ramification of fibers from the internal oblique muscle. So cremasteric muscle is going to be formed from internal oblique muscle in the abdominal wall. After the cremasteric muscle, we have the internal spermatic fascia. The internal spermatic fascia is going to be formed from the transversalis fascia, which is deep to the transversalis muscle. So these are all the ramifications. Now cutting internally here, you'll see the Tunica Albuginea, the Tunica Vaginalis first. The Tunica Vaginalis is going to be formed due to the processus vaginal, which is found in the derivative, or which is used in the embryologic origin for the movement of the testes from abdomen to the scrotum. So you're going to have the processus vaginal, and after that processus vaginal is going to form the Tunica Vaginalis. The Tunica Vaginalis has the parietal and the visceral layer. Now internally again, you have the Tunica Albuginea with all these appendix of testes and the appendix of epididymis. Here you are going to have the piriform plexus of veins. Here you are going to have the ductus, we have the genital branch of the genitofemoral nerve, and here we have the testicular vein. So this is what we mainly visualize here. Here, these are all the fibers of the external, this is superficie of the external iliac artery, but at this level is already called, because I've already passed the inguinal ligament, is going to be called the femoral artery. This is superficial epigastric artery and vein, and these are the other arteries and veins which are going to supply this portion here. So now visualizing the testes, you see that here is going to be the ductus deferens. Here you are going to have the testicular artery. When you cut the testis cross-sectionally, you're going to have the testicular arteries here. You're going to have the Pympiniform plexus. You're going to have the body of the epididymis. Here you're going to have the different lobules of the testes inside, which form the corp of the testes. You have the external spermatic fascia, which is the most outward portion. The most outward portion is the skin of the scrotum. Then you have the dartos fascia. Then after the dartos fascia, you have the external spermatic fascia. After the external spermatic fascia, you have the cremasteric muscle. After the cremasteric muscle, you have the internal spermatic fascia formed from the transversalis fascia. Then we have the this part here is going to be the vaginal cavity, not the vaginal cavity in female, but because this is a tunica vaginalis, the tunica vaginalis is made up of the cavity, a parietal layer and a visceral layer. So you have a parietal tunica vaginalis, parietal layer, and you have a visceral tunica vaginalis. In between, you have a cavity which could be called the vaginal cavity. Now, internally to the tunica vaginalis, you have the tunica albuginea. So internally to it, you have the tunica, which is directly in contact with the testes. You have the tunica albuginea. So this is the testes here. You have the ligamentous remnant of processus vaginalis here. You have the seminiferous tubulus here. You have the lobule. You have the parietal layer. You have the cavity. You have the visceral layer. Here you are going to have the septum. You are going to have your septum here. Here you are going to have the capsule of the tunica albuginea. This is tunica albuginea here. So the capsule at this location is going to be tunica albuginea, and it's going to give it different septums through which are going to separate the testes into different lobules, which are going to contain the seminiferous tubulus here. So at this portion here, we are going to have the rete testes. The rete testes are going to give out the efferent ductus or the vas efferens. Then all of them are going to ramify to form the epididymis. The epididymis is going to produce the vas efferens, which is going to come out and having different blood vessels attached to it, such as the testicular artery, the Pympiniform plexus, and all other vessels. So now let's visualize now the penis, the corp of the penis. You see that at this level is the deep perineal pouch. So you are going to this level is the superficial perineal pouch. So you are going to have the superficial transverse perineal muscle. At this level you have the perineal body here. This is the perineal membrane, lower part of the deep perineal pouch. You have the internal obturator internus here. Here you are going to have the ischio cavernosus. The ischio cavernosus is the muscle which is going to cover the corpus cavernosum. And here you are going to have the bulbous spongiosum. The bulbous spongiosum is the muscle which is going to cover the muscle which covers the bulbo. We have this muscle here, this is the bulbous spongiosum here. So it's going to cover the corpus spongiosum. So the bulbous spongiosum covers this corpus spongiosum part of the penis. So now here you are going to have different ligaments here. We have the fundiform ligament of the penis, and we have the suspensory ligament of the penis. So here you have different fascia involved covering the penis. The first fascia is the superficial fascia of the penis. Here you are going to have, you first have the spinal skin, then you have the superficial fascia of the penis. Deep to it, you have the deep fascia, you have the superficial fascia of the penis, then you have the deep fascia of the penis, called also the Burke's fascia. After the deep fascia of the penis, we have the Tunica Albuginea of Corpus Cavinosum. So after the deep fascia of the penis, you have the Tunica Albuginea. After that, we have the corpus sponge or the Tunica Albuginea of the Corpus Cavinosum. Then we have the Corpus Cavinosum. Then we have the Corpus Spongiosum. This Corpus Spongiosum then bulge out here to form the glands of the penis, and we have here the external urethral sphincter. Lastly, you have the prepuce of the penis. So all these are the different structures involved. So now here you can see the posterior section seal of the bladder and the prostate. You hear how you have the ampulla of the ductus deferens, you have the seminal vesicles. Here is going to be the lower trigone with your bladder. Here this is your prostate gland. Prostate gland, internally you have the urethra, then you have the bulbourethral gland, which are going to give some fluids production to the, and are going to come here to the bulb of the penis. This is the bulb of the penis here, the corpus, which is going to form the corpus spongiosum, and these other crusts are the crusts of the penis, which are going to form the corpus cavinosum. The crusts of the penis are covered by the ischio-cavernous muscle, while the bulb of the penis is covered by the bulbospongiosus muscle. So this is how the corpus cavinosum looks like when you visualize it histologically. So you see that it has the tunica albuginea, which covers it first, and that tunica albuginea are going to have septa inside, and the septa render the penis to be highly toughened. So now when blood vessels enter, when there is reduced blood vessel coming, blood coming from the penis, and there is much more dilation at the level of arteries, you see that there is accumulation of blood. The accumulation of blood renders the penis much more tense, and this is what makes the penis to be erected or during excitation. So we have the corpus spongiosum here, we have the tunica albuginea. So the corpus spongiosum is the main part which is involved with the stimulatory fibers of excitation, while the corpus cavinosum is mainly involved now with the erectile ability of the penis. So here is going to be inferior part of the membranous part of the urethra. You have the opening of the bulbourethral gland, and this is the bulb of the penis. So now let's dive now into the female tract. In the female tract, you have the body of the uterus here. You have the fascia or the bladder at this position here. You are going to have the symphysis here. The urethra is going to be located at this position here. Here you are going to have the bulb of the vestibule. Here you are going to have the clitoris. So the clitoris you first have the crus of the clitoris, just like the crus of the penis. You have the crus of the clitoris. All of them are going to bind now to form the glands of the clitoris. But here we need to know that the clitoris does not have a bulb. It mostly have the two cruces. The bulb is only going to be slightly below at this position, and this one is going to be the glands of the penis. So now this is for the clitoris. So now the vagina is going to be, you have the vagina at this position here, you have the bladder at this position here, having the urethra coming down, piercing through the deep perineal pouch into the superficial perineal pouch. Vagina still pierces into the deep perineal pouch into the superficial perineal pouch. Here you have the vestibule of the you have the bulb of the vestibule, and this is a greater vestibular gland. The greater vestibular gland is another form. So this is the greater vestibular gland. At first we had the bulbourethral gland located here, but here for females you have the greater vestibular glands instead located outward. So the greater vestibular gland sometimes can be called the Bartholin's glands in females. Here we have the vagina. So this is capable of producing Bartholin cysts. This is a perineal membrane, the deep perineal pouch, the vagina, the anal canal, the levator ani, the rectum, the external os of the uterus. So this is cervix of uterus, and this is the posterior fornix of vagina. The two different muscles posterolaterally here, we have the ischio-coccygeus and we have the piriformis. So now let's visualize the uterus with the ovary. So now superficially you have the bulk of the uterus here. Here you are going to have the cervix. At this position you are going to have the round ligament of uterus, which maintain the uterus in place. You have at this position here the uterine tube. The uterine tube, you have the suspension ligament of the uterus here, consisting of the ovarian and the ovarian arch and ovarian veins. And here you are going to have the left ovary. Here is the ligament of the ovary here. So this is the ligament of ovarian ligament here. So this is suspension ligament of ovary, and this is the ovarian ligament. So now at this position here, you instead have a deep section. So here you are going to have the fundus of the uterus. Here is the body of the uterus. Here you are going to have the endometrium, the merometrium, and the epimetrium. So here you have the internal os of the cervix. You have the external os of the cervix. Here you are going to have the cervical canal. At this position, you still have the ligament of the ovary, but inside you can see the follicles when you cut inside. So you have the different follicles located at the cortex. So when ovulation occurs, you see that the oocyte is going to enter here. So now the uterine tube is divided into four main parts. You have this part here, the infundibulum, then here's the ampulla, then here's the isthmus, and here's the intramural or the uterine part. So now let's visualize internally what these different structures are. So these are the different vessels. This vessel the suspension is going to contain the ovarian vessels, ovarian artery and ovarian vein. All of them are going to enter these ovaries. These are going to be the primordial follicles and primary follicles. Then you are going to have the secondary, then the tertiary, and all this till the end. So now, after having this, you have this other part here, the oocyte after ovulation. The femur are going to take the oocyte after ovulation, which are going to pass now into the ampulla, then into the this other part here. This is going to be infundibulum. Then first going to pass to the infundibulum. So infundibulum, then pass into ampulla, then isthmus, then intramural, and if it is fertile, it's going to be implanted at this position here. So now let's visualize the posterior aspect of the uterus. So visualizing the posterior aspect of the uterus, you have the fundus of the uterus here at upper part here. We have the ligament of the ovary here. We have the mesosalpinx here. We have the suspensory ligament of ovary. We have the left ovary. We have this mesometrium here. So at this position here, we are going to have the ureteric fold. Here is the uretosacral ligament. Here is the rectal uterine pouch. So these are different things that you can visualize here. Here is the mesometrium, so it should not be forgotten. Here is going to be the mesalpinx. So this is the part which is holding the posterior part of the uterine tube. So this is a mesometrium here, and these are the ureteric folds. So that contain the ureter. So you have the round ligament of the uterus here. So this is a mesometrium of the broad ligament. So these are the different portions that you can visualize. The connective tissue that you can visualize posterior to the. These are different connective tissue that you can visualize posterior to the uterus. So you have the uretosacral ligament. So this is another ligament, uterosacral ligament, which connect the uterus to posterior aspect here. So this is what you can visualize. Now again, you have the vesicular appendix. You can find the apoophoron and the paraophoron here, and this is the apoophoron and paraophoron are remnant of the mesonephric duct in the embryo. Here you are going to have still the ovaries. You have the ligament of the ovary here. So now let's see the blood, the venous drainage of the prostate. The venous drainage of the prostate comes from the superior vesical vein, and you have the inferior vesical vein, which are draining the prostatic plexus. So the prostatic plexus are going to enter into the superior vesical vein and also the inferior vesical vein. All of them are going to be drained there. So we have the we also have this part here, which is the drainage, the blood drainage of the vein. So this is going to be called the left dorsal arch and left dorsal vein, are both coming from the internal pudendal artery, but this one is going to be draining here and is going to have it drain into the prostatic plexus. This is the dorsal vein, so the deep dorsal vein of the penis. We have the superficial and deep dorsal vein of the penis. This is the deep dorsal vein of the penis, both entering. It can have a fiber which enters into the prostatic plexus, and it can also enter into the internal pudendal vein here. So this is what we have. So now this fascia here is a uterosacral ligament coming posterior here. You have the pubocervical ligament. So you have the pubis connecting the pubis and the cervical portion of the uterus. So that's the pubocervical ligament, and this ligament here is a uterosacral ligament. You have the pouch separating the uterus and the rectum called the rectouterine pouch, the pouch separating the uterus and the bladder called the vesical uterine pouch. So this is what is involved here. At this position here you have the ureter, and at this position here you have the deep perineal pouch. Here you are going to have the rectovaginal septum. Here is the pouch and here is the septum. Here you are going to have the pouch separating the bladder and the uterus called the uterovesical pouch. Here is a levator animosal inferior portion, which is going to ramify to the external anal sphincter. So now let's visualize the blood vessels coming from the internal iliac artery. The blood vessels coming from the internal iliac artery, we have number one, this vessel here, which is the umbilical artery. The umbilical artery normally is going to give the is going to form a remnant to the major umbilical ligament. Is going to be obliterated. So this is a remnant which is going to degenerate. This is the umbilical artery at first, but now at this other portion you have the superior vesical vein, the superior vesical artery. Here you are going to have the obturator artery. Here you are going to have at this position here you are going to have the inferior vesical artery. So here is the obturator artery. Here you are going to have the inferior vesical artery here. Inferior vesical artery. The inferior vesical artery and the superior vesical, all of them are supplying the bladder and the prostate gland. We have again posteriorly this superior fiber here is going to give this fiber here and these other fibers here. So this is the this fiber here first is going to be called the lateral sacral artery. So this part here is going to give the lateral sacral artery, and it's also going to give the superior gluteal artery. So this one here is going to give vessel here is going to give the lateral sacral artery and the superior gluteal artery, because it passes superiorly to the perineal muscle. And here this inferior one here is going to give you this artery here. This artery is going to be the middle rectal artery, and it's also going to give you the inferior gluteal artery. It's going to give you inferior gluteal artery with and also the internal pudendal artery. So this is the inferior gluteal artery here, and this is the internal pudendal artery. Internal pudendal artery passes external to external to levator animosals, and then posterior via the lesser sciatic, via the greater sciatic foramen, then passes posterior in the pudendal canal here as such, and then enters into the deep perineal pouch here. Before it enters into the deep perineal pouch, it's going to give the inferior rectal artery. So this is what the internal pudendal artery does. In the deep perineal pouch, it's going to produce the dorsal artery of the penis or the clitoris. Now let's visualize the venous drainage. For the venous drainage, we have this position here, the inferior vesical vein. We have the superior vesical vein. We have the inferior vesical vein and superior vesical vein. We have this part here, the superior gluteal vein. We have the lateral sacral vein. We have the median sacral vein. We have the piriformis. We have this position here, the inferior gluteal vein. We have the middle rectal vein. So they are still following the path. At this position, you have the lateral sacral vein, and we have seen the superior rectal gluteal vein. Here we have the inferior gluteal vein. We have the internal pudendal vein, and here was the middle rectal vein. Here the internal pudendal vein, before it enters the deep perineal pouch, is going to give the inferior rectal vein, and at this position, when it enters the deep perineal pouch, is going to give you the dorsal vein of the penis or the clitoris. So you see that it's similar in both cases. At this position, you are going to have the inferior epigastric arteries here. So now let's visualize the deeper section. So we see that here this is the internal iliac artery. The internal iliac artery is going to give posteriorly here the lateral sacral artery, and here are going to be lateral sacral veins. here is going to be the superior rectal artery coming from the inferior mesenteric artery. So all of these are going to with the middle rectal arteries here. This is the middle rectal artery. All of them are going to supply the rectum. We have here is you are going to have the uterus. So here you need to know, visualize that the superior rectal artery in females, in males are going, the superior and inferior rectal artery in males are supplying the superior and inferior rectal artery in males are supplying the bladder, but in females only the superior rectal artery is supplying the bladder, while the inferior rectal artery is supplying the uterus. Now the inferior rectal artery is going to anastomose with another fiber coming from the ovarian artery. So there are going to be this anastomosis here. So this is where it's visualized, the anastomosis here. So the uterine artery here is the inferior rectal artery, and is going to do an anastomosis. So this is the uterine artery this is the umbilical artery forming the superior rectal artery here, superior vesical artery here. So the uterine artery comes from the inferior vesical artery, and it's going to anastomose at its upper portion here with the ovarian artery. So we have this one here. We have the uterine vein, we have the superior vesical vein, we have the obturator vein here at these different positions. So this position here, we have the middle rectal vein. So you can visualize all the main structures which are being supplied here. So now in case of males, the difference is that we don't have a uterine artery. In case of the uterine artery, we are going to instead have the inferior vesical artery, and there is not this anastomosis. So we have this. Now again, in females, when you have you need to know that when you have a surgery of the uterus, where you want to remove the surgery of the uterus, most of the time there's first the deletion or the removal of this artery here, and this artery is going to be called the uterine artery. But the problem is that the uterine artery is very in close contact with the ureter. So when you cut the uterine artery, it may easily obliterate the right ureter and also the left ureter. So this is why most at first, when a surgery of the uterus involved with the cutting of the ureteric artery, this resulted to an acute renal failures in most women. This is because of when the surgery was performed, there was also an obliteration on the right and the left ureter. So this has resulted into a post-renal acute renal failure. So you have this here. Now in males, you have these structures. It's similar, but the difference is that you are not going to have the uterine artery, which is replaced instead here by the inferior vesical artery, and you are not going to have the ovarian artery. So this is the posterior section of the ovary. So the ovary here, you see that it has the uterine artery, the uterine vein, and the right ureter. All of them are here. The left ureter is here. So you see that all these are going to anastomose again with this other ovarian artery which comes inside the suspension ligament of the ovaries. They're going to come here, anastomose, and give all this the plexus of the uterine plexus of arteries and veins here. So here you are going to also have the vaginal artery, and the vaginal artery is coming from the external iliac artery, not the internal iliac one. So this diagram shows the blood supply drainage of the rectum. So you see that at this upper portion, you have the superior rectal artery and the superior rectal vein. Here is going to be the median sacral artery and vein here. You have the superior rectal artery and vein coming from the inferior mesenteric artery. At this position here, you have the obturator artery, but it's not supplying the rectum. Here you are going to have the umbilical artery, but not supplying the rectum. Here you are going to have the middle rectal artery here, supplying the rectum at this position. So the superior one is supplying the rectum above the middle transverse fold. This one is supplying between the middle transverse fold and the inferior transverse fold. So we see that the middle rectal is supplying above the levator ani muscles. above the middle rectal artery, supplying is supplying the rectum above the levator ani muscles. Why you see that the inferior rectal is supplying the rectum and the anal column below the levator ani muscle here. So you see that here it comes, the inferior comes from the internal pudendal artery, which is separating here into two. It has a corresponding inferior artery, rectal artery, and a vein with all these plexuses formed. If you have a blockage of the portal system, you can have hemorrhoids because of the plexuses as such. Normally, in case of the portal hypertension, blood comes inside, enters through blood, venous blood goes through the superior rectal artery, but hemorrhoids are going to be formed because it's going to anastomose back and try to flow back through the inferior rectal arteries and the middle rectal veins. The middle rectal veins is located here and is going to enter directly into common iliac vein here. So you see, it's going to pass through this portion, and this is going to produce hemorrhoids or accumulation of blood at this location here. So now let's visualize now the sacral plexus. You need to know that the sacral plexus and the coccygeal plexus are the plexus which are mainly involved with the innervation of the pelvis and perineum. Now we need to know that the sacral plexus has two main portions. It has a medial portion and has a lateral portion. Lateral portion of sacral plexus forms the superior gluteal artery, the inferior gluteal artery, the tibial and the sacral part of the sciatic nerve. We also form the quadratus femoris and inferior glomerulus. So these are all what is shown in yellow are going to be the lateral part of the dorsal division. With the ventral division at the medial part, we have this division here, and we need to know that the innervation of the pelvis and perineum is mostly characterized by having P in front of their name. So you have the first one, the pelvic splanchnic nerve. The pelvic splanchnic nerve, all of the nerves which come directly from the spinal cord at the level of the sacrum are going to be parasympathetic origin, because you said that the parasympathetic nerve are going to be craniosacral. So they are going to be parasympathetic in origin. So you have the pelvic splanchnic nerve of S2. So pelvic splanchnic nerve of S2. This is the first nerve which is going to be involved. The second nerve is going to the perforating cutaneous nerve, which is going to supply cutaneous at the gluteal cleft, intergluteal cleft, and the inferior gluteal cleft. You also have nerve to levator ani muscle and the coccygeal, ischiococcygis and all that coming from the coccygeal plexus. We have the anococcygeal nerve again. We also have the posterior femoral cutaneous. Posterior femoral cutaneous supplying the cutaneous to posterior part of the posterior part of the leg, not of the leg but of the thigh, posterior part of the thigh, posterior femoral cutaneous. We also have the pelvic splanchnic nerve of S3 and S4. So these are the main nerves. So the pelvic splanchnic nerve of S2, perforating cutaneous, nerve to levator ani. You have the posterior femoral cutaneous, and you have the pelvic splanchnic nerve of S3 and S4. So these are the main nerves involved with the pelvis and perineum. So we can visualize from here how they are going to enter. So this is S1 here, this is S2 here with the pelvic splanchnic nerve. So this is the nerve to piriformis here coming from S2. We have again this portion here. This is the inferior gluteal nerve coming outward. So this is a perforating cutaneous. The perforating cutaneous nerve is going to enter here and is going to supply the intergluteal cleft. Cutaneous to intergluteal cleft. We have the pelvic splanchnic nerve of S2 and S2 to S4. This is going to supply parasympathetic to the pelvis. We have the pelvic splanchnic nerve. So we have pelvic splanchnic nerve of S2 and pelvic splanchnic nerve of S2 and S3, S2 to S4, which are going to supply all the parasympathetic nerve of the pelvis. We have the anococcygeal nerve, which are going to supply the this muscle, with the coccygeal plexus are going to supply the coccygeus muscle, and they are going to have also nerve to ischiococcygis and levator ani, which are going to supply the ischiococcygis, the levator ani, and external anal sphincter here. So we also have the nerve to gemeli, to inferior gemeli and quadratus femoris. So we have the obturator nerve here. The obturator nerve is going to go to the lumbar plexus. So now we have here again the lumbosacral. So we have the lumbosacral trunk here. This is what we have. So here we are going to have nerve to piriformis as such. So now we need to visualize here. In this diagram, we are going to have a separation between the parasympathetic supply to the pelvis and the sympathetic supply to the pelvis. So now we need to know that the parasympathetic supply is craniosacral in origin, while the sympathetic supply is thoracolumbar in origin. So we need to know that the pelvis is located at the level of the sacrum. So all the fibers which come into this hypogastric nerve, are going to be all going to be parasympathetic fibers. So all the fibers which come directly from the spinal cord are going to be parasympathetic origin. So all the fibers which come from the splanching nerve which come directly from the spinal cord, like the pelvic splanching nerve, all are going to be parasympathetic origin. Now the sympathetic nerves comes above from this superior hypogastric plexus, and they also come from the sympathetic trunk here. So you see that the sympathetic trunk are going to be connected with above here, and they are going to have fibers which are going to enter into this inferior part here. This inferior part is going to be the left. These are going to be called the hypogastric nerves. So we have the superior hypogastric plexus, and here are going to have the inferior hypogastric plexus divided into two, the right and left hypogastric nerves. Now you need to know that the hypogastric nerve are going to contain the postsynaptic fibers. They are going to contain the postsynaptic fibers of the sympathetic nerve, and they are going to contain the presynaptic fibers of parasympathetic nerves. The parasympathetic nerve comes and enter into the hypogastric plexus directly from the spinal nerves. So they are going to come out from the spinal nerves and then enter into hypogastric plexus. While for the sympathetic nerve, they can either come from the superior hypogastric plexus after coming from the sympathetic chain from above, or they will come inferiorly by entering first into their synapses and then coming outward here. So they will not come directly from the spinal nerves like in the parasympathetic fibers. So here you are going to have your ganglion impar, which is the last ganglion, and here you are going to have your coccygeal plexus, which is going to supply the ischiococcygis muscle. And you can also have some other nerves which are going to go to supply the levator ani and the external anal sphincter. So this is what you can visualize. So this is where the inferior hypogastric plexus is going to function. Inferior hypogastric plexus is going to move to the rectum to supply parasympathetic and sympathetic to the rectum, and also to the uterus with the bladder and the prostate gland. So now in this diagram we can visualize now the different perineal pouches. So when someone is placed at this position, it enables us to visualize the different perineal pouches. So here is first the glands of the penis, here is the body of the penis, here is the testicle of the scrotum. At this position here we have the bulbospongiosus, here you have the anal aperture, here you have the levator ani, you have the gluteus maximus here. So here you are going to have the perineal membrane, you have the superficial transverse perineal muscle. So let's visualize when you are going to cut each of the different muscles deeply. So here you are going to have the symphysis pubis. So you need to know that we have different triangles which are going to be formed. We have the urogenital triangle, or the anterior triangle, which is going to be formed between the pubic symphysis, the two ischial tuberosity. They are going to be the anterior triangle. The anterior triangle is involved in the gynecological system. And now you also have a posterior triangle formed from the ischial tuberosity posteriorly to the coccyx here. It is involved in the gastrointestinal system with the rectum in surgery. So here we have the approximate position of the perineal body here. So now let's visualize now in females. In female you have this, at this position, the glands of the clitoris, you have the labium majus, here you have the urethral opening, you have the vaginal opening, here you are going to have the bulbospongiosus, here you are going to have the superficial transverse perineal muscle, the levator ani, here the ischial tuberosity, the labius minus, and you have the Ischial Cavenosus. So this is how you are going to visualize. Here you see that the urogenital triangle is much more larger with the perineal body at this location here, and the posterior portion is less compared in male posterior triangle. So this is, you are going to be a pubis symphysis. Here is your mons pubis. Here you are going to have the approximate position of the perineal body. You are going to have the ischial tuberosity here, and here's the coccyx. So now let's visualize the perineal pouch. You now need to know that at this position here, you're going to have pubis symphysis. Here you have the urogenital hiatus. Here was the puborectalis muscle. Here was the pubococcygeus, and here was the iliococcygeus muscle. So these are the different muscles that you need to visualize here. At this position, this is at the level of the pelvic outlet. So this was pubic symphysis, the ischial tuberosity, and the coccyx here. So now let's visualize how the superficial and deep perineal pouch are going to be. So now deeply here is going to be this is the perineal membrane. So we start from deep and then go to superficial. So at deep position here, you are going to have the deep perineal pouch. The deep perineal pouch, inside the perineal pouch in males, you have here the external urethral sphincter, you have the urethra, you have the bulbourethral gland, and you have the deep transverse perineal muscle. So this is what you have deeply. Now, when you enclose the perineal membrane with the perineal membrane, you are going to enclose the deeper portion of the perineal pouch. So this, when enclosing the perineal membrane, you are closing the portion of the perineal pouch. So now, as you enclose the portion of the perineal membrane, in females now at the deep perineal pouch, you instead have, we initially said that in males had a longer urethra, so they only need one muscle to enclose the terminal of the urethra. While in females, we say that there is both the urethra and the vagina to be enclosed. So the first thing is that, and the urethra is very small, so three muscles are now involved to enclose it. You are going to have the external urethral sphincter. You are going to have the Sphincter uretrovaginalis. The Sphincter uretrovaginalis is closing both the urethra and the vagina, and you have the compressor urethrae, which is enclosing the urethra much more. Here you have the deep transverse perineal muscle. Here at this position, if you enclose it, you're going to have the perineal fascia, which is going to cover the deep perineal pouch superficially. So now, yes, you're going to have the vagina. Here's the perineal body. Here you're going to deep perineal muscle. Posteriorly, here is going to be the levator ani. So now, so this is what is going to be found in males, and this is what is going to be found in females. Sphincter uretrovaginalis, the compressor urethrae. While in males, you only have the external urethral sphincter. In females, you have three muscles. You have additional two muscles, the compressor uretrovaginalis and the sphincter uretrovaginalis. The compressor urethrae and the sphincter uretrovaginalis. So now, let's visualize now the superficial perineal pouch. In the superficial perineal pouch, you have the bulbospongiosus here. Bulbospongiosus here, you have the median raphe. Here, this is the perineal membrane which separates the superficial perineal pouch with the deep perineal pouch. Here is going to be the Ischial Cavenosus. Here is going to be the perineal membrane here. Here is going to be obturator internus. Here is going to be the perineal body. Here is going to be puborectalis, the sacral tuberous ligament. Here is going to be pubococcygeus part of levator ani. Here is the levator ani muscles here. Here you see that superficially, in the superficial perineal pouch, you instead have the superficial transverse perineal muscle. Here is going to be a body of penis, the suspension ligament of penis. Now, at this position here, deep to the bulbospongiosus muscle, you have the bulb of the penis. Deep to the Ischial Cavenosus, you have the crus of the penis, and here's the perineal membrane. So when you remove the muscles, you can visualize here. So at the position here, the crus of the penis anterior, you have the Corpus Cavinosum. Anterior portion of the bulb of the penis, you have the Corpus spongiosum, and the Corpus spongiosum is the one forming the glands of the penis. This is what you can visualize from this superficial perineal pouch. So now here in females, superficial perineal pouch, you're going to first have the crus of the clitoris, and at anterior terminally you're going to have the glands of the clitoris. Here you're going to have the bulbous spongiosum muscle still. Here you're going to have the vagina and the superficial transverse perineal muscle. Here at the level of the bulbous spongiosum muscle, now it's no more going to cover. So you see that the greater vestibular gland are replacing the bulbous spongiosum, are going to replace the corpus spongiosum in males. So you have the greater vestibular glands here. So these are the greater vestibular are going to replace in females. So we have the greater vestibular glands with the bulb of the vestibules here. They are going to replace the corpus spongiosum in males. So we have this. They are going to have, you have the crus of the clitoris here at this position here, and you have the vagina at this position. So this is a perineal body, which is the one which is a point for attachment levator and also for the fibers of the perineal membrane. So from here we visualize the main sections involved with the uterus. Now we are going to visualize now the fibers of the internal pudendal artery and veins which are involved here. The fiber of internal pudendal artery, here you are going to have first fiber, the inferior rectal artery, which I've already visualized. After the inferior rectal artery, so that we know that the inferior rectal artery is going to give fibers anteriorly. One fiber are going to traverse here, that are going to be transverse perineal arteries, branch of the perineal arteries. Then here you are going to have the perineal arteries. So this is the perineal artery and vein here. Now the perineal artery and vein are going to supply the the bulbous spongiosum and the ischial cavernosum, and they are going to come posteriorly here as the deep dorsal artery and veins of the penis. So you have the deep dorsal artery, you have two deep dorsal arteries, and you have only one deep dorsal vein. So now as it comes now in females, this is similar. Inferior rectal artery, you have the perineal artery with the transverse perineal branch. You have this artery here, artery going to the bulbous spongiosum and the ischial cavernosum, going to as to form the dorsal arteries of the clitoris and the one dorsal vein of the clitoris. So now for the nerve, you have the inferior, we have the pudendal nerve now still forming the inferior rectal nerve, and then we still have the perineal nerve here. Now coming up here, you're going to have the dorsal nerve of the penis. So here you have two dorsal nerve of the penis. In case of the female, similar, you have the inferior rectal nerve, you have the perineal nerve which is the transverse part here to the bulbous spongiosum, and you also have the dorsal nerve of the clitoris here. And lastly, we are going to have the lymphatic section, the lymphatic drainage. The lymphatic drainage of the internal is going to be via the different lymph nodes. The lymph nodes involved are the middle sacral lymph node. We have the common iliac node. You need to know the common iliac. We need to first know that they are going to start at the level of the internal iliac lymph node. We have the internal and the middle sacral lymph nodes, which are going to take fibers and going to enter it into the common iliac lymph node, and from the common iliac lymph node, are going to move up via the pre-aortic lymph node. As they move up via the pre-aortic lymph node, they are going to enter with the cisterna chyli here. They're going to have also the cisterna chyli, move with the pre-aortic lymph node, and then further entry into the thoracic duct. So from here we visualize all the things, all the different sections involved in the pelvis and perineum. And we can say thanks for that kind of attention. Please don't forget to like and subscribe for science video makers. Thank you.